Namaste everyone. Today we are going to discuss about basics of urinary catheterization. So the primary objective of this presentation is just to look upon basic things about urinary catheterization. That is, we'll discuss about how many different types of catheters are there and what are the procedure or what are the basic steps involved in urinary catheterization. And before that, we'll look upon certain terminologies and anatomy related to urethra and which is important in urinary catheterization. So let's start. Next slide. Okay. So the contents of this presentation is, of course, introduction to the terminologies. And the next we are going to discuss about anatomical review. We won't go in detail about the anatomy. We'll just superficially cover the points which are important to us. Next, we are going to learn about the definition and indications of catheterization, that where we are supposed to do catheterization. And next, we'll discuss about various types of catheters, various size of catheters, and then we'll switch on to basic procedure in males, females. How do you take care of the catheter, and then removal of catheter, and last, the complications. Okay, so let's start. So, okay, now this slide is a little vague. It isn't very much informative, or it's just vague slides or vague terminologies which we must know before knowing about catheterization, right? So introduction and terminologies. Now elimination. Simple. If you don't think much about elimination, so what is elimination? Elimination is simply a process in which you are eliminating something out, right? And here, in terms of body, we are eliminating waste products, right? So there are various ways in our body that helps us to eliminate the waste, like lungs helps to eliminate the carbon dioxide and various other. But now here we are going to discuss about two forms of elimination, that is via urine or via stools. Okay, so if that urinary elimination is not happening due to reasons which I have mentioned following, mainly because of urinary retention, what do? We go for catheterization. And when stool evacuation isn't happening, we go for enema. Right? Simple. So elimination is a process in which we are eliminating the waste products, and in this presentation we are going to talk about the elimination of urine in case of urinary retention, that is via urinary catheterization. So let's discuss the other terminologies that has been mentioned here. Right? First, we'll discuss about dysuria. Okay. Now, what is dysuria? Dysuria is nothing but this means difficulty in urination is dysuria. Polyuria is when you are having poly, बहुत ज़्यादा बार if you are going for urination, or if the quantity of urine is increasing, that is polyuria. Per se, greater than 2500 ml per day is polyuria. Now, what is oligouria? Oligouria is a little less quantity, right? That is less than 400 ml per day is oligouria. What is anuria? Anuria is you are not able to produce any urine, or you are unable to produce even 100 ml of urine per day. That is anuria. Now, the next terms are of much importance to us, that is urinary incontinence. Now, what is urinary incontinence? Incontinence, it means that you are not able to have control over your urination, or there is involuntary pass out of your urine. Jisko hum commonly we can call it as dribbling. We can commonly call it as dribbling of urine. So why does urinary incontinence happens? So it could happen to due to various reasons. For example, if a person is very old and he mainly in male, if they don't have any control over their this urination process, so then there and then urinary incontinence can happen. And simple management, like very simple things which we can do is this. In such patients, we usually perform emptying of the bladder every 2 hours, either by using condom catheters, etc. So these processes will be dealt in further slides. Okay, and the next thing which is there in urinary incontinence is that if a patient or any patient is having urinary incontinence, we suggest them to go for Kegel exercises. Now, Kegel exercises you must know, or you have read about them in gynecology as well. So Kegel exercises are nothing but these are exercises which you do in order to strengthen your perineal muscles. So that is something you suggest in urinary incontinence. Anyhow, we are just looking upon these terms. Next term is urinary urgency. So urinary urgency is nothing but when you feel a good desire to go and pass out the urine. So, our bladder can store up to like 500 ml without having any, very much reflex, strong reflex or strong feeling for urination. But when this amount goes up to like 500, 600 ml, when it goes up to 600 ml, then there is a strong urge. And at that point of time, you will call it as urinary urgency. Now, the major term or the term which we have to look upon, because it is the basic of our slide, that is urinary retention. Now, urinary retention ka matlab kya hota hai? What does urinary retention mean? It means that patient is unable to pass out the urine. Urine is not, the patient is not even able to pass out the urine anyhow, or it is somehow blocked, or bilkul hi pass out nahi ho raha hai, anuria ho gaya hai, right? There is not even 100 ml of urine, the patient is not able to pass it out, right? So that is urinary retention. Now, what could be the cause? Primary cause, if we don't think about big diseases, we can say that if there is lack of privacy, that very commonly it happens. If there is lack of privacy, the person may not be able to pass the urine. Retention of urine may happen. So that could be a cause. Now, if we think about big reason, other causes could be due to obstruction. If there is any sort of obstruction, for example, in case of elderly males, if there is like a benign hypertrophy of prostate, then due to that obstruction in the passage of urethra, urinary retention may happen. Also, it can happen due to anesthetic effect. Now, after anesthetic effect, after surgery, urinary retention may happen. Right. So these are some general causes of urinary retention. Now, how would you access that there is urinary retention in a patient? Now, it's very simple methods are that you'll find tenderness over the lower abdomen, right? Or you may also find the distension of the lower abdomen if the bladder is filled, right? And other method of assessment could be percussion. If you do percussion, there would be a dull sound you will, or the dull note you will get on urinary retention, because there is urine filled inside, right? If the bladder would have been empty, you will find a tympanic sound. But here you'll find a dull sound. So these are general assessments if you want to look for urinary retention. And certain common managements, as in we'll go for removing the cause management. So if there is lack of privacy, you provide privacy to the person. And if you are not able to pass out the urine and there is no big pathology, then you should provide an appropriate position. For example, in women's, appropriate position is the squatting position to eliminate the urine. In males, it's the standing position. Also, this is a very normal technique which is usually performed in children. If children are not passing urine, then what does the grandmothers do, or what is the common thing they do? You just open up a tap, and with the sound of water coming out of the tap, what happens that there is a psychological stimulation to pass out the urine. So that could also be done. And if nothing works, then there is certain maneuvers, that is like the creed maneuvers they have told, in which what you are doing, you're not doing anything, but you're just doing some abhyanga or massage over the abdomen, and you're doing hot water fermentation. Even Acharya Charak has mentioned about this, like abhyanga, avapidak, and sway, when there is mutraveg avarod, and in the chikitsa that has also been mentioned. So these are certain maneuvers or certain common management. But if nothing works, then you have to go for catheterization. Let's switch on to the next slide. Now, this is a little, non-detailed. We are not going to look very much upon the anatomical review, but we'll understand a little about the kidneys, about the bladder. Mainly, we'll understand about the bladder and the urethra. So, an empty bladder, it will be situated in the pelvis. Now, when bladder gets filled, it comes to the abdominal cavity up to the umbilicus. It can come, right? So that is what you need to know. And the kidneys are paired of retroperitoneal glands, and urine will be formed in the kidney, and then you will find ureters, which are 25 centimeter tubes, and it is going to connect the kidney to the bladder, and it will perform the function of drainage. Next slide, please. Okay, and now let's discuss a little about urinary bladder. So as I told you that it's a hollow organ, and it's situated in the pelvic bone, right? And what does urinary bladder do? Basically, urinary bladder is made up of muscle, and those muscles are kind of whirling around, or they are coming together in form of whirls, right? So that is detrusor muscles, with which like this bladder is made up of. So there is this equal contraction of these muscle, which will be responsible for emptying the bladder. It's not peristalsis which is happening in the bladder, so you need not much know about it. Like we'll move on further to the procedure. So that's about the urinary bladder and urethra. Yeah. Now this is important. We'll discuss about the urethra, because you are going to insert, when you're going to do learn about this catheterization. What you will be doing here, you will be inserting the catheter via this meatus up to the urethra, and you will be taking it up a little inside the bladder, right? So let's it's very important to discuss about the urethra. So first we'll discuss about male urethra. Now, as you know, male urethra is what is the major difference between male and female urethra? That male urethra is a lot longer than female urethra. Like it is 18 to 20 centimeter long, and it extends from the bladder neck, like it is extended from the tip of the penis up till it is going up to this urinary bladder. And as you can see in this picture as well, that it is S-shaped. S-shaped. In flaccid penis, you'll find a S-shaped urethra, and when the penis is erect, you will find it to be J-shaped. So that is a major thing you need to know about male urethra. Next slide. Okay, so now there are various parts in which urethra has been divided. Major parts we'll talk about is the prostatic part, the membrane, which is the posterior part in the male urethra. So prostatic part is like the part, as you can see on the screen, which is surrounded by this prostate. So this is 3 centimeter long. The widest and most dilatable part in the urethra, and it is extended from neck of the urinary bladder up till the prostatic, and it is going anteriorly to the membranous part. Now, membranous part is the smallest part, and it is important because it is having an external urethral sphincter. And the longest part would be the penile urethra, which is about 15 centimeter long, and it lies in the corpus spongiosum, and it is opening up in the external urethral meatus. And there is a slit, which is this urethral meatus. It is about 6 mm. Now this slit is about 6 mm long, and it will open up into the urethral meatus. So this is enough. Now let's discuss about female urethra. Now female urethra is relatively very, very short, and that is why female experience more urinary tract infection. But when it comes to catheterization in male is difficult as compared to females, because in females the urethra is only like 4 centimeter long, but in males you have to go like how many, 15 to 20 centimeters in, or more than that, because you have to go a little inside the bladder as well. So female urethra is 3.8 to 4 centimeter long, and it begins at the urethral orifice. Now internal orifice is nothing but if you have a bladder, and the urethra will start. So where the urethra will start, it is the internal urethral orifice. So from internal urethral orifice, and it is running interiorly behind the pubic symphysis, and it will go near around the vagina. Now, how do you find it? I hope you would have studied gynecology very nicely. So you will be able to, now when women is lying in lithotomic position, you will find the opening of this urethra 2.5 centimeter behind, or 2.5 centimeter behind the glands of clitoris, and it will be behind this. It will be a little upward to vagina if you see a woman in lithotomic position, and it will be 2.5 centimeters away from clitoris. Next slide, please. Now this is storage of urine and micturition of urine, which I think you will be very much familiar about. So we won't discuss it much. If you want to read it, you can read it from here. Next slide. Now let's come to the actual presentation, which is urinary catheterization. Now, how do you define urinary catheterization? So in urinary catheterization, what you are doing, you are using a urinary catheter. Now that catheter could be made up of a latex, polysilicon, and even a rubber tube. And now what will you do of this urinary catheter? You are going to insert into a patient's urinary bladder. And how are you going to take it to the bladder? You are going to take it via urethra. Now, in urinary catheterization, a latex, polyurethane, or silicone tube known as urinary catheter is inserted into a patient's urinary bladder via urethra. Now, catheterization, as we have discussed, like it will allow the patient's urine to drain freely from the bladder for collection, right? So that is simple definition of urinary catheterization. Now, what is the purpose of urinary catheterization? As we have discussed about urinary retention. So this procedure relieves urinary retention. Now, what else can you do of this catheterization? You can obtain a sterile urine specimen. Say if you have a patient and the patient is unconscious and you have to take the urine sample. So you cannot, ask the patient to get up and give a urine sample. You will do catheterization, right? So to obtain a sterile urine specimen, you will use this urinary catheterization. Now, if you have to measure the residual volume, you'll also you can go for urinary catheterization. Now, this is also very common indication. Like if you have to empty the bladder before surgery, during surgery, after surgery, we'll do it via urinary catheterization. And again, urine output you can also measure through urinary catheterization. Now, there is one more point which isn't mentioned here, that you can also instill drugs using this urinary catheter. So we'll discuss various types of catheter, and we'll understand that how this urinary irrigation or installation of medicine can also be done using urinary catheters. Now, common disease indications are if there is chronic urinary retention, if the patient is having neurological injury before surgery, if the patient is having paralysis, if there is any kind of spinal injury, and very common if there is benign prostate enlargement, then you can go for urinary catheterization. Now let's come to the procedure. First of all, we'll discuss about what articles would we require to do this catheterization. So before this, we definitely need to know that because we are putting something inside, say indwelling catheter. Indwelling means something which you are putting inside. Okay, there are various type of catheters. Indwelling is there, external catheter is there. So in general catheterization, what we are talking about, we are putting something inside the urethra. So you need to make it sure that you are doing it in completely aseptic environment, because otherwise you are going to introduce infection into the patient. So you will require articles. These articles must be sterilized, and you also need to wash your hands or sanitize your hand many times so that you don't introduce any infection. So this is must thing, that you should not introduce any infection because the most common complication that is seen in urinary catheterization is of urinary tract infection. So you must ensure that whatever you use, whatever you do, it should be absolutely sterile in nature, right? So articles is first, of course, you need some apron which you are going to wear. Then, of course, you need a catheter, and you have to attach that catheter to a Euro bag. Then after that, to clean the patient, you would require sterile dressing pack. In India, we use betadine solution. Next, what you would require is a pair of sterile gloves. And then when you are doing this procedure, I'll tell you how and when you instill this. There is a lubricating gel which is having a little like lignocaine gel, which is also anesthetic in nature. So how you are using that, you also require this. We'll be discussing it further. Now again, drainage bag, Euro bag, same thing. 10 ml syringe. Why would you require 10 ml syringe? That also we'll discuss after we study about the various types of catheter. Now you require normal saline and distilled water. Why do you require this? We'll discuss further. And kidney dish to keep these articles. Next slide. Okay. So now let's discuss about various types of catheters. Now catheters, as I told you, these are just the material in which is made up of. It could be made up of silicone, rubber, right? And there is various different utilities of the kind of product they are made up of. If you're using it still, if you're using some catheter which is made up of silicone, you can use it for a longer period of time. Or in patients like neuro patients, where you need to do catheterization for a longer period of time, because these neuro patients or the patients who are in coma, they cannot evacuate the urine by their own. You need to do a long-term catheterization. So to be, so that the patient's family could afford it, there is these silicone catheters are there. Rubber catheters, you can use them for about 28 days. So these are few materials of catheters, and now we'll discuss about what are the type of catheter. But before that, also we'll discuss about the size of the catheter. That will also come in slide, but we'll discuss previous slide. but we will discuss general sizes of catheter we have, right? For example, in next few slides, we are going to see a table of various color-coded catheters. But when you are going to decide a catheter, generally for adult male, you will take 16 to 18 French sized catheter, right? French is a unit which is particularly for diameter of catheter. So in adult male, you are going to use 16 to 18 French. In female, you are going to take 14 French, and in pant, you are going to use a 10 French catheter. Now let's come on to this picture of the catheter, right? There is indwelling catheter, you can see on the screen, and this is the most common catheter, and I think most of you would have seen it. This is the Foleys catheter. The second one is intermittent catheter, and this is the simplest one, and the third one is external catheter, right? We'll understand about this. Now, indwelling catheter is nothing but the catheter which is going inside the urinary bladder, right? A common example would be a Foleys catheter, and you could see now it is having two lumens, right? The one lumen is with red and the other lumen is simple yellow, right? We'll understand about different parts of Foleys catheter in the next slide. The second catheter is intermittent catheter. Now it is having just one single opening. Now this is the most simplest type of catheter, and this could be even disposed. These are the one usually disposable ones. So they are only useful when you have to empty the bladder like instantly and for a short period of time, or maybe once. For like when you have to obtain sterile specimen, or when you have to check the residual volume. So you may use this intermittent catheter. And the first one, indwelling catheter, which is the double lumen catheter I told you about. So this is the most common one, which is done in clinical practice. And the third one is the external catheter. So external catheter, a common example is condom catheter, which is very commonly used in old patients, in which there is who are having this complaint of dribbling of urine. So you use external catheter in those patients. So they just look like a simple condom. You are just going to the patient is just going to wear those catheter, and whatsoever urine is dribbling, that will be collected in the urobag. Now the next two tips of the catheter, in previous three, when we saw indwelling catheter, intermittent catheter, you saw the tip, they were pretty straight, right? So pretty straight tip, but now here you see that there are two types of tip. There is a straight tip and there is a cowdy tip. So cowdy tip catheters, they are also simple catheters, but they have a slightly tilted tip. Now, where do you use these cowdy tip catheters? As we have discussed, that one of the common indications in catheterization is the patients who are having benign hypertrophy of prostate. Now, you see, when you will have, we discuss about this anatomy, and we saw that prostatic part of urethra, the urethra was surrounded by prostate. Now, when hypertrophy is going to be there, the passage will be narrowed. And it will be difficult to do this catheterization in such procedures. Or if there is any other sort of obstruction, then also when you are inserting the catheter, there could be a little problem. So to resolve that problem, there is this pointy cowdy tip catheter, which will help the catheter to move further and which will relieve a little obstruction. That is why you have a cowdy catheter, and straight tip catheters are like you saw in indwelling catheter, intermittent catheter. They are usually having straight tip. Slide. Now we have discussed all these points, which is written here, that there is rubber catheter, there plastic catheter, there are silicone catheters, and there is indwelling catheters. Okay. Now this is also very interesting to note that what are suprapubic catheters? That the process which we are going to study here is simply urinary catheterization, where you are inserting this catheter from the urethral meatus. But in case you cannot do that, there is suprapubic catheterization, that suprapubically you are making some incision and then inserting the catheter through it. So that is suprapubic catheter that we won't discuss here. Next slide. Next slide. Next slide, please. Okay. Now, these are the catheters which are of very much use, and we must know, how they are useful for us. Like in this picture, you can see there is two-way catheters. Now, one is for a male, one is pediatric catheter. So they are like 2-lumen catheter, and at last you can see that there is a 3-way catheter as well. Now, we'll discuss about what are the various part of Foleys catheter. Now you see that there are 2 openings. One is urine drainage port and another one is balloon port. Now urine drainage port is, as the word suggests, that it is going to drain off whatsoever is coming from the bladder, right? So that is for urinary drainage. Now what will the balloon port do? Balloon port, what you are going to do from this port is nothing, but when you have inserted this bladder opening, when you have inserted from the bladder opening tip, you are going to insert this catheter up to the urinary bladder. So when you have inserted it up to the urinary bladder, you can also see, behind it you will find this, there is balloon which is not inflated right now. But when you have when you are sure that you have reached the urinary bladder, you have to make it sure that it does not come out, right? If it is going to be a single thin wire which you are inserting out, it could also come out easily, right? A little traction and catheter will be out. You don't want that to happen, right? That is why you are having a balloon here. So when you are assured that you have reached, how will you be assured that you have reached the urinary bladder? When urine starts coming out, right? So you will be assured that you have reached up the bladder. You will insert like 1 to 2 centimeter more inside, so that you are sure that you are there in the urinary bladder. And after that, what you are going to do? From this balloon port, you are going to take a 10 ml syringe, and from this balloon port, you are going to insert either distilled water or normal saline. And what will this balloon port do? This will carry that normal saline or the distilled water to this balloon, and it will inflate the balloon. To inflate that balloon. Now, after inflating the balloon, what will happen? Near the neck of this urinary bladder, it would be stuck inside. It won't come out easily. So that is the purpose of this balloon port and this balloon and this hole of catheter. I hope now Foley's catheter is very much clear to you, right? So we have talked about 2-lumen catheter. Now what is this 3-lumen catheter? Now 3-lumen catheter is nothing but 2 lumens are the same. 1 lumen is for drainage of urine. Another lumen will be for a balloon, inflation of balloon, and the 3rd lumen. Now, if you have to instill some medicine, or if you have to carry out this bladder irrigation, what you are going to do? You are going to via this port, you are going to instill medication or irrigate the urinary bladder through it. So that is the utility of this 3-lumen catheter, right? So we have discussed about 1-lumen catheter, and we have discussed about the 2-lumen catheter right now, and we have also discussed about the 3-lumen catheter. And also in the previous slide, we saw the condom catheters, which we use in generally, which we are using in old age. Now let's talk about the size of the catheter. So I've already told you what is the general consideration for the size, and according to the side, you will also find these color codings in this catheter. For example, in previous slide, you must have found like red colored. So that was 18 French. Like you can match it here. It was 18 French catheter. That is the common catheter you use for male. For females, it's 14 French, which is a common like green color. And for pediatric purpose, you use a 10 French catheter. Like in previous slides, we saw the second catheter, which was a pediatric catheter, and it was black in color. So size of catheter usually the manufacturers follow this color code, and you'll find these catheters of various sizes according to this color code, and you can identify it from here. So I've told you about everything that catheter relates to the thickness or diameter of the catheter. It is measured in a French gauge, which we commonly say French, 16 French, 8 French, 6 French, 10 French, like that. So this is we have discussed it. The common in male, common in female, and common in pediatric. Now let's switch on to what are the common positions in which you should position the patient while you are doing the procedure. Now, if you have a female patient, you should put her in lithotomic position so that her perineum is exposed. And if it is a male patient, you should put the patient in the supine position. Next slide. Okay. Now, in the following slides, we are going to see pictorial. We are going to do pictorial study of this procedures of catheterization in male, catheterization in female, and removal of catheter. So first of all, we'll start with catheterization in male. Now, this is very, like you can say, pre-procedures which you need to ensure before you are doing the actual procedure. The first thing, which is of much importance and which, you generally forget or you don't do, but it is important. The first thing is that you should tell the patient what procedure you are going to perform. You must explain to the patient how it is happening, what you are doing, and you must take a consent of the patient that you are performing it and for what benefit. So it is important. First thing is, it is very important to explain your patient what you are doing. The second thing that you can see here is continuous washing of your hands. You have to continuously, after you even after you touch any article, your hands or any of the articles which you are going to use, you should wash your hands, because you must avoid giving infection or giving any sort of UTI to the patient. So you should avoid. So you should wash your hands after that. After that, what should you do? You should remove the clothes of the patient, and you should place this patient in a suitable position, which we have discussed that for female, you should place her in lithotomy position, or you should place the patient in supine position. You should ensure that the patient is comfortable. If you can even provide a pillow for the comfort, and you should not entirely expose the patient, right? You should not remove all the clothes. You should cover the patient with sheets, and whatsoever region is required for the procedure, you should only expose that patient. And prerequisite last procedure would be to have a complete trolley prepared. So you should ensure that everything is there. There is disposable aprons are there. There is entire this catheterization pack is there, and whatever you need for lubrication, that is there. Sterile pair of gloves are available. You should ensure that everything or all the articles which we have already mentioned, they are present. Next slide. Okay, now we are actually going to do the procedure. So first of all, when you have all the articles assembled, and by assembly I mean you have also connected the base of the catheter up to this urinary bag. So what you are supposed to do after you clean your hands, you are going to tear off. And now what in the first picture you can see that there is this lubricant jelly or anesthetic jelly. You are going to tear it off, and then you are tearing off the jelly. After that, you are going to place a sterile sheet beneath the area, like penis in this case. Beneath this area, you are going to place this sterile sheet, and then with your undominant hand, you are going to hold the penis and retract the foreskin if it has to be retracted. And after that, what you have to do, you have to insert this jelly over this meatus of the patient. Next slide. There is something wrong with it. Okay, now I think it is not there in this slide, but before you do all these things, I think one slide is missing. Before you do all these things, the very first thing you should do is to clean the entire area around the penis. So what you have to do, you have to take a gauze piece, you have to dip it into the betadine solution, and you have to hold it with the forceps, and you have to clean the entire area. After that, before you even put this anesthetic jelly, you have to clean the entire area. You have to make the entire area sterile. So you will use a betadine jelly, and in a circular motion, and from an area which is like from the meatus up till the base of the penis, you're going to clean it first. And after that, you are going to do that procedure of inserting this lubricating jelly in the over the meatus and the urethra. Now, after you have done this cleaning, and after you have administered this lubricating jelly, what you are going to do, you are going to and after ensuring that you have connected this catheter to the uro bag, what you are going to do, you are going to tear off the tip. Now you can see it in the third picture. You are never going to touch the tip of the catheter, because that way you can introduce infection to the patient. So you're not going to touch the tip of the urinary catheter, and just touching out the outside plastic, you are going to open up this tip of the catheter, and you would insert, holding the penis over from your non-dominant hand, and with your dominant hand, you are going to insert the tip of the catheter into the urethra. Next slide. Okay. Now you should insert now because it's a male patient and the urethra is like around 15 to 20 centimeter long. So you have to insert it slowly and slowly and slowly, and make it sure that you don't do any hurry, or if you find any resistance, you should stop the procedure. And very slowly you have to insert this catheter within the in this case you have to insert this catheter into the penis of the male patient. And near around, like if somehow it is gone, and if you find some obstruction, that could be even due to the sphincters. So what you're going to advise the patient to do a little cough, and if the patient will cough a little, the sphincters, they're going to relax a little, and you may be able to insert this catheter easily inside. Now when catheter will move inside the urethra and reaches up to the bladder, you are going to find that urine is coming out, and you will see it into the tube or the urobag. So then you will make it, then you should be ensured that now the catheter is inside the urinary bladder. Now, what is the next step which you are going to do? When you know that the catheter is inside the bladder, you are going to, that picture is not here, but you are going to inflate the balloon using a normal saline or this distilled water. You're going to inflate the balloon. Now, when you have inflated the balloon with the gentle traction, you will understand that now this catheter is inside and it is fixed. After that, what you're going to do, you are going to stick this lead or wire of the catheter up to the thigh of the patient. Next slide. Okay. After you have fixed that catheter to the thigh of the patient, you are going to place the urobag below the level of the bladder. Now, why would you do that? Of course, you let the gravity work and let the urine drain out into the urobag. After doing all this procedure, you're going to dispose of all the things which you used, and after disposing of and washing up your hands, you're going to note down everything, like why did you do catheterization, and what type of catheter it was, what was the expiry date, everything, what lubricating gel you used, what was the date when you administered it, what was the amount of urine that was drained, everything you would just do a little paperwork and you wrote it. So that is how you do catheterization in male. Now we'll understand how do we do catheterization in female. It's a similar procedure, but a little different because the urethra is a little different in females. Now, primarily, as we know that first of all, you are going to explain the procedure to the female, that what you are going to do to her, and is she going to be irritated by this procedure. You have to thoroughly explain what you are going to do on the female patient. Okay, there may be a little hesitation or anxiety the patient may be facing. So you should relieve that anxiety or hesitation. Next, you are going to again clean your hands and remove the clothes of the patient, but remember, you should not entirely expose the patient. You should expose just the area which is which you require, and you should place the patient in the supine position. You should provide pillow for comfort. You should cover her with appropriate sheets, and you should have a trolley prepared. Next slide. Okay, now here this cleaning process is nicely given down. Now you will ask the female patient to stay in lithotomy position, and after that she is in lithotomy position. After you wear sterile gloves, what you are going to do, you are going to clean the area. Now here, how do you perform this cleaning? You are again going to use a betadine solution or any other thing whatsoever you are using for cleaning. You are going to expose the labias, the outer labias, the inner labias, and from front to back. You should remember, front to back you have to clean it from front to back, and after you use one wipe, you throw it and you use the other wipe, so that you don't introduce any infection. Our primary purpose of doing so many steps is just to minimize the amount of infection we provide to the patient, right? So that is why we are doing these much steps. So you must ensure that the meatus is totally wiped out, and you are going to do it in front to back fashion. Now, after you are done with cleaning of the patient, then you are going to remove a little sheet from the perineal region, and you are going to use the lubricant jelly over the meatus of the patient. Next slide, please. Okay. Next slide. Okay. So after you are done with the cleaning, what you are going to do, you are going to use this lubricant jelly, and you are properly going to lubricate. You should first of all, you should clearly understand where urethra is, right? You must know the clear anatomy of the perineum, that it is situated in front of vagina and behind the glans clitoris. So you must locate it properly, and after the lubricating, and after that you should lubricate the urethral meatus. Then you should from this meatus, you should insert a little anesthetic or lubricant jelly within the urethra as well. So that is the next step which you are going to perform. Next slide. Okay, after performing this, again, now this is also very important. After you have touched these articles, like you have touched this stage, you have touched this, so it is very important that before you do any process, you're again washing your hands. You're again going for washing your hands, because anyhow we have to avoid the infection. And after you ensure that your catheter is connected to a urobag, you should start the procedure. Now, how should you start the procedure? Again, you have to tear off the covering from the tip of the catheter, and in such a fashion that you don't touch the tip of the catheter. Even with sterile gloves, you should or you must not touch the catheter, because that is something you're going to insert inside the patient. So you should ensure that you tear off the tip of the catheter without touching it. Next slide. Okay, now when we clearly understood that where the urethral meatus is, you're slowly going to insert the catheter into the urethra up till you reach the urinary bladder. Now here it's female urethra. You need not go very much deep into female urethra is about 3.5 to 4 centimeter, right? So you need to go like 6 centimeter or 7 centimeter so that you reach the bladder. You have to make it sure that you are not lying in the urethra. You have to reach up to the kidney, right? So when it's like around 6 centimeter inside and urine is coming out, you'll be sure that it is inside urinary bladder. And again, you're going to inflate the balloon using that syringe, and from balloon port, you are going to inside 10 ml of normal saline or distilled water. Now, I think we should discuss it here that what is the utility of normal saline, or why we are only using normal saline or distilled water. Now, both of the things are indicated. In commonly, we use normal saline. But if you have to catheterize the patient for a long term, you won't use normal saline. Why? Because normal saline, again, it is having crystals of sodium chloride. And if you're going to use it for a longer period of time, what will happen? Crystallization may happen. And if crystallization may happen, you won't be able to deflate the balloon. Crystallization would have occurred. So when crystallization would have occurred, when you are removing the catheter, it will definitely impose some problem. So when you are using a catheter for a longer period of time in such patients, what we are going to do, we are going to use distilled water simply. And where you don't have to do this catheterization for a longer period of time, you may use normal saline, and that is the one which is commonly used in our hospitals. Next slide. Okay, after you have inserted the catheter properly, you have to tie this wire of the catheter over the thigh of the women, and you have to make it sure that the bag is a little, below the level of the urinary bladder. I'll just take a 5-minute pause. Recording. Okay. So we stopped. Had inserted the female catheter. Okay. So we were discussing that after inserting the female catheter and after inflating the balloon, what we are going to do, we are going to attach the catheter to the catheter to this thigh of the patient, and we are going to put the urobag a little below the level of the bladder so that the gravity works and the urine is free. After you do this, what you have to do, you have to dispose or discard of all the things you use, all the gloves you used, and again you are supposed to wash your hands. And you should make it sure that whatsoever you need to record, like what was the reason for catheterization, what was the size you used, what was the expiry date of the catheter, what was the expiry date of the lubricant and anesthetic jelly you used, what was the amount of urine, everything whatsoever you want to record, you have to make it sure that you record all those things. Next slide. Okay, so now I hope you would have you understood that how this procedure should be carried out. Now, these were simple basic procedures, nothing much. You just have to insert the catheter into the via urethra into the urinary bladder. Pretty simple procedure, but they have so many steps, because in every step we are ensuring that we are providing a closed urinary drainage. Okay, so this is important. You're providing a closed urinary drainage so that you don't allow the bacteria to enter in, right? So that is why we are having so many steps. That is why we are having this hand wash and sterile things, because you should make it sure that you don't introduce any infection to the patient. Now, after your patient has this urinary catheter, how you need to take care of that urinary catheter? Of course, you have to wipe the urinary catheter. Of course, you have to clean this area around the catheter, and you have to clean the meatus. So how should you do that? That, of course, when you are handling the catheter or when you are even touching the catheter, you should always wash your hands, and you should always make it sure that whatsoever the tube of the catheter is, that is not getting twisted, that is not getting any kink. Or again, we have told about that you should keep the urine bag below the level of the bladder so that the gravity works and the urine is drained out. And you should also make it ensure that you should not drag the catheter or you should not pull the catheter. And this is important. Now, if you see any signs of inflammation or any signs of infection, what could you see? You could see pus, you could see you could even see the patient is getting very much irritated. You could see redness over there. You could have tenderness over there. These are the signs which will indicate that there is some sort of infection. And when there is infection, you must remove that catheter and put the patient on antibiotics, so that the patient is not further having any more infection. And we were discussing about the care of the catheter. Again, after washing your hands and everything, how do you have to clean the catheter? You have to, or you must clean it at least twice a day with a simple soap and water. How you are going to do it? That you're going to take a clean bucket or whatever tumbler you are using, or you can even do it with wet wipe. Wet sterile wipe. How you're going to do? You are going to take up one wipe and you're going to from the meatal area to this urobag area. You're going to wipe it off, and after wiping it off one time, you won't again go back and one unidirectional wiping you have to do so that you don't infect the person. So one wipe, unidirectional, you discard the wipe. So that is how you're going to wipe off the catheter. And you must not apply the powder or lotion around the skin or around the skin which is near the catheter, and you should not even pull the catheter. So these are certain important things which you need to take care of, and of course cleaning of catheter is necessary. And in next slide you'll also understand how do you actually remove the catheter and what care you should take while you're removing the catheter. Now this is again they have talked about UTI, that you should anyhow while we are doing so many procedures, this is all to avoid any urinary tract infection to the patient. So you should use everything sterile, the sterile packaging. You need to clean your hands before you touch the catheter. Even before washing the catheter, removing of catheter, you should make it sure that you are providing a sterile environment. Now, what will you advise the patient? You must advise the patient that your patient must drink plenty of water so that the urine is clear, and by this you can help the patient to prevent infection. And regarding this drainage of urinary bag, so every 8 hourly, or when you find that this bag is half full or this bag is getting full, you should keep on draining this, or you should keep on draining out the urine from this bag. How you are going to do that? How and what sterile things or sterile maneuvers you are going to follow? Again, you are going to wear the gloves, and you're going to wash your hands, then wear your gloves, then just open the walls and you drain out the urine and you close that valve. In a very sterile fashion you have to do it. Generally it is done by the patient itself, but you also have to advise the patient that you do it in a sterile fashion, otherwise you're going to introduce infection to yourself, right? Next slide. Okay, so these are the steps which will be involved when you are removing the catheter. What will you require? You will require sterile gloves. You will require a syringe. Now, why do you require a syringe? Again, you have to you inserted that 10 ml of distilled water or normal saline. So you have to deflate the balloons. For that, you will require a syringe, and then you will require some towels. And again, then you have to wash your hands and you have to empty the urobag. Now, You can see in step 2, they have taken a Eurobag near the toilet seat and they are opening the valve in step 3 and 4 and they are draining out the urine which is collected in the Eurobag. Now, after you have done this, you are going to wash your hands. Next slide. Now, after washing your hands, you are going to wear a pair of gloves. And what you are going to do, you are going to remove that clip. We have attached this tube to the thigh of the patient. You are going to remove that tube or remove that attachment. After that, you are going to deflate the balloon. You can see it here. Using the syringe, you are deflating the balloon. And in step 9, you could see the balloon has been deflated. And now in step 9, you can pull out the catheter very slowly. You are not going to apply any pressure or any tension to the catheter. You're slowly going to pull that out. That is how you are going to remove the catheter. And again, you have to advise the patient to drink plenty of water so that you reduce the chances of getting any urinary tract infections. Next slide. Okay, so again, this is the procedure of removal of catheter. We have already discussed. Now, in last slide, we saw, how do we have to empty the collection bag, and you have to just follow those steps before removal of catheter. How you have to remove or empty the collection bag. You have to empty it up 8 hourly, or when it is bedtime, you need to empty that catheter. Again, you have to clean your hands, open the valve, close it. Again, the similar steps. Just have to maintain a sterile environment while you are emptying the collection bag. Next slide. Okay, now we'll understand the certain complications. Till now we have understood that one common complication and common complications of urinary catheter, or why we have complicated these steps so much, is to avoid a complication, that is urinary tract infection. We must avoid urinary tract infection. And what are certain symptoms you will experience in patient? We discussed certain regional symptoms, that there could be redness, there could be swelling, there could be pus discharge, etc. Now, other symptoms could be patient may have fever, chills, headache, and in Eurobag you may find cloudy urine coming out due to pus, and there would be a burning sensation in the urethra or genital area, and there could be leakage out of the catheter, and you could even find blood in the urine. So these are the common. So this one is the common complication, that is UTI, and again you may find the foul smelling urine, and patient may have low back aches, and patient may be a little icky if he has acquired a urinary tract infection. Other than this UTI complication, other complications could be allergic reaction. Now you're using a catheter which is made up of latex. Patient could be allergic to anything, so you may experience some sort of allergic reaction in the patient. Even continuously if you're going to use catheter, you may have bladder stones, or if you have lacerated urethra, you may find blood in the urine, or you may injure the urethra. And when you're using long-term indwelling catheter, it may have certain kidney damage or septicemia infection to the kidney, urinary tract, or even to blood could also be the common complications of the catheterization. So thank you so very much. These were the basics of urinary catheterization. You need to perform it on your own so that you understand how these steps are conducted out when you are actually to perform these procedures. So I think you've understood like some basics of urinary catheterization. You will now be able to identify the different types of catheters. And thank you so much for patient listening. Namaskar.